disclosures. They're on the AOS website, none of which are really relevant to the content of this talk. The premise of this is really a focus on orthoregeneration, and it goes by a number of different names: orthobiologics, therapeutic biologics, but really the fundamental goal is tissue regeneration. Certainly we want to accelerate healing, reduce pain, promote better function, but tissue regeneration after an injury is really what we're after. And to set the stage for this, we really have to look at the burden of rotator cuff disease, which we know symptomatic tears can be a significant time loss to injury, and cost savings are associated with rotator cuff repair. But what if we could potentially avoid individuals, at least a subset of them, from progressing to full thickness tear and a requirement for surgery? And so the emphasis for a long-standing time has been that of biologic factors. And as a part of that, we really want to look at medicinal signaling cells, as coined by Arne Kaplan. And that's to recruit other cells, that's to secrete these bioactive factors, and then it's, to some extent, promote some immunomodulatory or inflammatory dampening effect in the milieu of the rotator cuff tendon. And I think ultimately, while we've seen the benefits of corticosteroid injections, we also have to be well aware of the case against it. It creates non-tenocyte proliferation. It promotes this degenerative process. We know that there's a risk of re-rupture or adverse events after post-operative injections, and arthropathic changes can continue to occur. So as you look at this, definitely consider PRP as one of our workhorses moving forward. And really, we think that this accelerates the graft or tissue integration as well as the neovascularization process. But it's important to realize that not all PRP is created equal, right? As we look at individuals across the room through our clinics, you can see there's differences